This video presents breastfeeding challenges of immigrant mothers who combine breastfeeding with employment. This study was undertaken in Saskatchewan, Canada. Dr. Sheila Hirani and her team acknowledge the support of Saskatchewan Health Research Foundation that funded this study. We acknowledge that there is no actual or potential conflict of interest. Financial instability was leading many immigrant mothers to pursue employment soon after their childbirth. Immigrant mothers facing financial instability were finding it challenging to sustain their breastfeeding practices. Many immigrant mothers in our study were not entitled to maternity or parental leaves because they were working as casual or part-time employees. Immigrant mothers facing breastfeeding challenges shared that in Canada they feel pressured to pursue employment so they can pay for their childcare expenses, groceries, rent, bills, and other expenses. Limited social support was another barrier for the immigrant mothers who were combining breastfeeding with employment. Immigrant mothers in our study highlighted that lack of spousal support and clash in their work schedules is the biggest barrier to their breastfeeding practices. Immigrant mothers living in the nuclear family systems shared that the lack of access to affordable and breastfeeding-friendly daycare centers makes it challenging for them to combine breastfeeding with employment. Lack of breastfeeding support in the workplace is identified as another key barrier to successful breastfeeding. Immigrant mothers trying to combine breastfeeding with employment shared that not many employers are supportive of their breastfeeding practices. Nature of work and non-availability of support from coworkers are additional barriers to breastfeeding practices of immigrant mothers associated with employment. Non-availability of space to breastfeed or pump breast milk in the workplace was another barrier. Immigrant mothers working in a variety of workplace settings reported that lack of opportunity to breastfeed or pump breast milk in the workplace causes breast engorgement and affects their breast milk supply. Immigrant mothers shared that non-availability of a breastfeeding room in the workplace was forcing breastfeeding mothers to express breast milk in the washroom, which is not hygienic. Employed mothers wished for a breastfeeding room as a safe space in their workplace setting so they can pump breast milk. No time to breastfeed or pump breast milk in the workplace is another challenge for immigrant mothers who are employed. Immigrant mothers shared that the high workload, nature of the workplace, and lack of flexibility in the workplace impose additional barriers to breastfeeding. The findings of this study highlighted that financial stability, social support, workplace breastfeeding support, safe space, and time to breastfeed or pump breast milk in the workplace setting are essential to promote, protect and support breastfeeding practices of immigrant mothers who combine breastfeeding with employment.